Hi friends, hope you're doing well. I'm Dr. Milind. So a lot of students have now started preparing for NEET PG and next exam next year. So here I'm going to talk about one very effective strategy. So recently, I have been receiving a lot of mails and messages about the students that the problem they're facing. So I had a chance to interview a lot of toppers and to listen to this theory, and I have brought all these stories to you through the interview series. So there are a lot of points that came to my notice, and also through my experience, I have summarized everything that is going to help you a lot because I have, after reading the mails and messages from the students about the difficulties they are facing and what is the most logical and more practical way of cracking this exam. So today I'm going to give you a few very important tips. So what is the first problem that students are facing? That there is so much material to cover. The classes has so much to offer, and when we look at the time, it seems so less that we know that exam is going to be somewhere between Jan to March. Still the official date is not there. So today in this video I'm mainly talking about targeting NEET PG exam and not NICT, and also this mainly for the students who are thinking about taking a drop and who have been preparing for some time. Also there's a lot of anxiety and uncertainty at every step that whether I will be able to do it or not, so it is also affecting them. Also I had released the sample about starting from June 1st. A lot of students have started, so there are a lot of missing targets. The timetable are not able to follow, the backlog is piling up. That is because classes are giving notes, there are videos, there are previously years questions, there are custom modules, there are q bank, there are grant tests, there are image based questions. So there is so much of things. So what to do, what is the best way? I mean, when we listen to a lot of toppers, we listen to the class teachers and everything, and it's all adding to the confusion. So how to deal with it? So first, as I have said, first you have to make a plan. So I have released that planner. The image which you are seeing here is actually the planner I have released. So you can first, if you have not watched this video or any planner, even if you are making your own timetable, that is also acceptable. But if you need one example, I have released this video, so you can see this plan where I have seen that in 90 days you can finish your first read by arranging these subjects. So how can we do it in time? Because a lot of students are not able to finish that in time. So first, my advice is do the hard and important things first. So see, it's not like that we should follow what is traditionally being followed. We should know our strengths and our weaknesses. I will always see that start with your rank building subject. So I think most of the followers of my channel are already aware of the rank building subjects. So mainly they are your first and second top subject. So first you start with your rank building subject, and when you start with them, you read to understand. You just don't finish them. It's not food that you have to finish and go ahead. You should read them and try to understand the concepts. So let's break down this subject. So first, when you read anatomy, so you have your class notes. Suppose you are following any classes, just take the notes, start reading the notes along with the narrators. See, if you are someone who is just reading the notes and not keeping the atlas by your side, you will never understand anatomy, you will never read anatomy. With every page of anatomy you read, you should always have an image, either a PDF of netter atlas or a hard copy. Or if you don't have both, if you're not able to get both, then at least search on Google, save that image in similar order of your reading, and with notes and images do that. Don't watch videos for anatomy. Don't spend your time on videos. See, it is not going to give you any additional things. If you know that nerve is there, you will identify. You are going to get image in your exam anyways. Second subjects are like biochemistry and pharmacology. So do your notes and first aid charts and tables for biochemistry and pharmacology. So what in first aid you will see these cycles are arranged nicely, and a lot of enzymes, and they give a lot of mnemonics for both for pharma and first aid. So don't go for videos. You have to save the time, so don't go for videos. Just read your class notes along with your first aid charts and tables. Microbiology, again, notes and images. Now in microbiology, every line has image related question. Like if you read about a bacteria, they might ask you the structure. If you read about a culture, they might show you about a biochemical reaction. So best way I feel is to use Google. So whenever you read about, for example, you read about some fungi, so just search on a Google, whatever search result you get, you take a screenshot of it and save it in the similar order of your reading. So whenever you are reading these notes, you just open these images which you have already taken a screenshot, and similar question you are going to get. See, what classes or what anyone is going to provide, you are not going to get exactly that image. But when you have seen multiple images, it becomes easier, and it's become easier to remember when you are reading it with theory. For patho and physio, what I feel that here you read your notes, but here you might need to see the few classes videos, because you need to understand few concepts in physiology, because about cardiac cycle, about few equations about fluid and electrolytes. So a lot of concepts are there about neurophysiology. Also some pathophysiology, sometimes it's difficult to understand, but it is very important to have good command on these two subjects to solve medicine questions, to solve clinical scenarios. So here you can take help of videos. So whenever you feel that you are not able to understand your some part of physiology, some part of pathology, you can definitely take help of the videos. So what are these subjects have in common? That these all subjects are mainly fact based. Not lot of things change with time. The nerve that was passing there 50 years back is still passing from the same canal. The enzyme that was in the same reaction, it is still there. About most of the drugs in pharmacology are same. There are only few new drugs are coming in exam. Microbiology also, apart from COVID, apart from few updated guidelines, there is nothing new. It's the same questions again and again asked. That is why first you when start reading your subject, couple it with your previously asked questions. At least for NEET PG, do last 8 years. As I said, these are fact based, so they don't change with time. So at least try to finish your last 8 years subject. So when I divide the day, if you have seen the planner, I said that whenever you divide your day, do major subjects. For example, if you're sitting home not working, so you study for 5 to 6 hours, you study your, let's say, anatomy. Then you couple that with short subject like 2 to 3 hours you study dharma, and 2 to 3 hours, as I say, every day you do the MCQ practice. So in the beginning you do your previously asked questions first, because questions and topics do get repeated. So don't fall for QBank and custom models as of now. I'll explain you in the subsequent slide that why it is important. Now once you are done with your, let's put a line here. So you are suppose in, if you give I have given 9 days each for these subjects. So in 54 days you will finish your 6 rank building subjects and 6 short subject when you couple them together. So you in 60 days you will have that you will finish your 12 subjects. So 70% of your paper will be done. So 70% of the paper, as you know that this is the most of the questions come from them. So 70% of your paper will be done. So this is when you give your grant test, and you should give it with the similar intensity as of exam. Don't start giving grant tests as of now. It's a waste of time, and I'll tell you why. So at the end of 60 days, when you are done with these subjects, do you give your grant test and then make a chart of GT analysis. So I have already released one video about how to analyze GT, and I have shown the charts there. I'll show you it here also. So once you finish your subjects, so let's talk about this. So we have given divided these subjects. So this is the target accuracy I am telling. So this is what you should target. So this should be the target of percentage of correct questions in your GTs from these subjects. Also for short subject, this should be your target. And then you should start giving GTs, and you should underline whichever are your weak areas. So first you give GT after 60 days, then after 100 days of your preparation, then 125 days and 150 days. Now if you're looking for if someone have done it, so I had received one email from a student. So this is a chart of some student that she had prepared. So you can see that she exactly followed this percentage, and you can see the number of GTs. So in a month, if you are able to follow, like February she gave 2, in March she gave only 1, in April she gave 2. So as you can see that the number of GTs are not many. In month she is giving only few GTs. You can see she is her biochemistry percentage was so less, like 36%, patho was less. So she had highlighted whatever the weak areas she had, and you can see that slowly as she improved, that her the number of highlights became less. You can see that there was a definitely improvement. As I say, that even if you are not, for example, it was difficult to get that accuracy in biochemistry or maybe pharma, but she was getting much better in like medicine, what expected, like from surgery she was getting like 90s and 80s, but expected is 60 to 70%. So the things will make it for one another. So this is how you have to assess your weaknesses. Don't say just bluntly that this subject is strong. If you are getting consistently good result of this percentage in these subjects, then say that your subject is strong. And with this hard work, and I think this girl has scored rank of 1000. So she mailed me about this GT that which helped her, and that is why I'm recommending. See, lot of students, I'm just giving you one example, a lot of students are using it to assess your weakness, and that is actually how you should analyze your GT. Then don't analyze your GT in one day. Take 4 5 days, like just analyze 50 days, 50 questions every day, that you whatever GT you give. So today, see, you are after giving 3 hours of GT, your brain is tired. So don't spend more time. Tomorrow, next day, do 50 questions. I say 50 questions each day. In 4 days, you will finish the analyzing of GT. You will remember it better. You will retain it better. Now, whenever you look at your, suppose you gave 4 GTs, then after 4 GTs, see, initially your graph might look like this red graph, that it is looks very less score, but it is good that it is consistent. Your graph should never look like this blue line, that it should not go like haphazard up and down. Our target is to decrease this gap. So these are two ideal graphs, the green one and the red one. That consistency should be there. Once you have done your GTs, you have to classify your subjects as strong subject and weak subject, and depending on that we will formulate the next strategy. Now, as I talked about the first and second prof subject, about the rank building subject, what about the other subject? So once you are done with your basic sciences and short subject, now go to the remaining of rank building, which are PDA, Ophthalm, ENT, and medicine, PM, surgery, medicine, and PSM. So these big four subjects. So we all know it's very difficult to cover these four subjects because they are huge. So as because they are huge, we have to follow only the high yield topics. So again, I have released the video about the high yield topics, where I have also shared the PDF of important topics. Now these high yield subjects are not something that I think are high yield. These are taken from all the classes recall videos, and you can find it everywhere. Like, these are not something that I invented. These are, we all know that these are the high yield subject. Now what is important, that when you take that PDF, always follow this order. See what happens whenever you are going to read surgery, PSM, medicine, or these big subject. They are very huge subjects. So whenever you start reading, initially while reading surgery, you are very excited. You have all the energy. So you start with high. You are very interested in reading. So once you have that energy, you do all the important topics. So these all 7 topics, we all know that the breast, thyroid, GI surgery, then trauma like tension, pneumothorax, and burns, triage, resuscitation. So these are very important surgical topics. Urology, they are very important. So whenever you have good energy, like when you're starting, you finish them. But at the end of the surgery, you realize that, okay, my time is running up and I have to finish this quickly. So you start rushing up. So then you have to read what is less important. Like, even if you miss, for example, salivary glands or CNS tumors, about transplantation, or blood products, or oral cavity lesions, if you miss them, if you're not able to read them, it's okay, because not many questions are going to come from there. And even if questions will come, a lot of students won't know. So this is what you have to follow. You don't have to do mistakes from these topics. So you start in this order. So I have shown you here about surgery, but there you will find all these important topics from all these subjects. So you follow that order and do it only from notes. So for these subjects, you have to just follow notes and PYQs, nothing more. And you have to just keep revising them. Now, as you must have seen that in my strategy, I have not talked a lot about videos, about the custom modules, about the Q bank, and about the image based questions. So this questions is very obvious that classes has so much to offer, that they have like lot of features like pearls, or like a lot of things are there. But is it practical to cover everything? So we have to ask ourselves, is it humanly possible to finish all this portion in limited time? No, it's not possible. If I can finish whole MBBS course in 6 months, then why would they keep MBBS tenure for so long? So this is an obvious explanation, that to cover everything that is there in the class notes and everything that is the class is providing, it's impossible, because that should be covered in your MBBS tenure. Also, if you have paid for it, it does not mean that you have to use it. See, don't say that I have paid for, like, there are classes who have very extensive plans. So if you feel that I am going to get value of every rupee that I have invested in this app, then you are wrong. You are doing harm to yourself. So you have to invest your time smartly. So what is the ideal method? So once you classify your subject as strong and weak, with the help of your GT analysis chart, the subjects which are strong, which are consistently, see, not by one GT, but when you consistently give GTs, by that you decide which subject is strong. So for the strong subject, as we say in medical line, continue same treatment, continue the same method that you are doing. For weak subject, now it depends on weak subjects, which subjects are weak. Suppose your subjects which are weak are anatomy, biochem, micro, ENT, and short subjects. So these are again very important subjects, and you can realize that these all are fact based subjects. So it means that you have to just know the facts. You don't have to understand concepts. See, to know the from where which now pass, you don't need concept. You just should know which enzyme catalyzes which reaction. There is no concept, it's a fact that this enzyme catalyzes this reaction, so you have to know it. Suppose this bacteria that causes this infection, so this is a fact, it is going to be there. Also for the short subject derma, you see, you will not see a lot of changes in derma, you will not see a lot of concepts, you should know what are the lesions and what are the characteristics. So to save time, do custom modules. So whenever you realize that even after reading theory your these subjects are weak, do custom modules. That is your you can do the subject wise test. So open your suppose you are finding micro difficult, so you just do the custom modules in total. So what happens, even if you don't remember, you remember the question and answer in exam. As I say that, everything is fair in love and war, so this is kind of war situation we have. So when you have a when you know the question and answer, it's okay, as long nobody's going to take your viva after exam that how you got it right. You just have to get it right. So that is why I say that do custom modules for especially for those. And if you have done like 5 years of pyqs, add 3 more years. If you have done 8 years, do 2 more years, because these are fact based. There is not the answer is not going to change even over a decade. Avoid videos as much as possible for this subject. See, don't, even if you have temptation that video looks nice, my friend said the biochem videos are very nice, but avoid that temptation, because you don't have that much time to watch video for everything. So let go that temptation and finish that video, finish that subject in time, so you can do the custom modules for them. Second, subject like physio, patho, pharma, pedia, ophthalm, surgery, obs, gynae. So I personally feel that physio, patho, pharma form the basis of your medicine, and some pedia and opthal are very difficult to understand. And I feel that if next happens, most likely everybody says that NEET PG is going to happen, but if next happen, pedia and opthal are going to have a higher weightage. Lot of opthal terminologies, lot of opthal topics are very difficult to understand, and they are something that we are very naive, very new to us. Also for pedia, surgery and obs gynae, though they are from the large subject, there are also a lot of things that we don't know properly, because we get exposure of medicine, we get some exposure of PSM during our early years of our undergraduation, but these are something new. So you can watch videos for them. So something that physio you don't understand, you go and watch videos. Something you don't understand in pharma mechanism of action, you watch video. Ophthalm, watch video. Surgery, you are not able to understand like trauma and what exactly they are talking about burns, you watch videos. Obs gynae, suppose you are not able to understand what are these stages of labor, so I should watch watch videos. See, investing time to understand concept is never a waste of time. Actually, it act as a one revision, and it saves you one revision, so it has a similar effect of doing a one revision. Then why not to do it for each subject? Because we don't have time, we have to use our time effectively. Lastly, for medicine and PSM, you see, it's okay if you have in your GTs and your analysis you are getting this subject weak. Just do the notes and PYQs. Don't go for videos. See, if you watch medicine videos, it will take 1 year. If you start doing the custom modules for medicine and QBank for medicine, it's like an ocean of MCQs. If you have a good command on physio, patho, pharma, and micro, a lot of your medicine questions will be taken care of. Similarly, PSM, there will be a lot of difficult questions. There are things about stats which you will be just by reading and doing PYQs, you will get a good command on them. So save time. This your medicine and PSM will never affect your rank. What your rank affect, where your rank affects is in the rank building subjects. So what I learned from my seniors and from interview with toppers and my own experience. See, all you need is just class notes, selective videos and custom modules for the difficult and tough topics, and limited number of GTs, and which should be analyzed wisely, and wise image based source selection. And I always prefer Google. QBank is advised if you are doing the classes for UG period. See, a lot of students say, sir, you yourself also promote a lot of QBank. There are a lot of YouTubers who promote QBank. Yes, definitely, because there are UG students who also are the follower of our channel. So for them, QBank can be beneficial, because it requires time. But if you are someone who is planning to finish, preparation, who are planning for a 6 months, then QBank is not a good idea. But there are people who have scored a great rank without even touching even a single question from QBank, just by doing the custom modules and notes. You have to select limited data, you have to revise it frequently. More you read and more you the resources that you refer, more the confusion in exam and more are the silly mistakes. So there are a lot of students who do everything that is available there, and they end up having a very bad rank in the real exam. So whatever I have talked, so does it make sense? I mean, what if I feel that I'm telling you not to do the q bank. I'm telling you to be selective with videos, to be selective with custom modules. So why does it make sense? See, claim of students that to crack exam in 6 months are not very true, because not everyone starts from zero. So you'll see a lot of toppers, lot of brilliant people, they tell you you can crack exam in 5 6 months. See, I am not disrespecting them, it's their hard work what they have done. But what actually we don't pay attention to, that the starting point for everyone is different. See, when you are in the competition, now you're competing for the PG exam. So there are some students who were the part of the foundation batch, who since their UG have read all the textbooks, even they have read the textbooks that you never heard the name of these authors, the foreign authors. These students are like kind of gold medalist. There are some students who maybe they were awakened late, but still in their final prof they were aware, okay, this exam is coming, so they have started preparing them. They did their classes during their internship. So there are some students like that. Then there are some students who after their internship, they got to know, okay, I should prepare, and who are in the top 20 30,000 in the last NEET, but still they are preparing again because they want a better rank. And then there are students who just started, okay, I want to, and who are like have rank more than 60,000 in the previous exam, and now who are dreaming big. So actually what is here, that we are having a competition. So the lot of students call PG exam as a race. So what we have here is a competition between the Ferrari, between the super bike, between the car, between the bike, and between the cycle, and they all are running the same race. So you should identify where you are. If you are someone who is kind of who is driving a Ferrari, I mean who has so much of foundation, so definitely you don't need to do, so you will do a lot of things, so you have time to do the q bank because your theory is already done. You read your notes fast. But if you're someone who is like cycle, or who is like bike or car, so you cannot afford to do everything, because these people have already done it, they have started it earlier. So this is the group who needs to plan their time wisely. So also one more example I would like to tell you, that about the foreign medical graduate exam. So most of so let's see if it makes sense to you. So a lot of FMGs, they graduate in June and July, and they prepare for 5 to 6 months for their FMG exam, and they attend offline classes. I agree that passing rate is this exam is low, but there are significant number of students who score between 180 to 250 out of 300 in this FMG exam. If you have seen the scores, so let's keep our disagreement about FMGs aside. Whatever opinion you have about FMG exam or FMG students, one fact that we can't neglect is FMG paper is near replication of PG paper, and such score. So if we score about like this 180 or 250 in our NEET PG exam, we will end up in top 5 to 10,000. So like 180 score will definitely make you end up in top 20,000 rank, and if you score go near to 50, you'll end up in top 5,000. So that is what happens. So why FMGs are able to score, like there are few, but why they are able to score this kind of score? Because what point I'm trying to make it here, that reading a limited but important data lead to better score due to less confusion and silly mistakes in exam. So a lot of these FMGs, when they prepare for NEET PG, now they think that we have to read a lot, and they refer to a lot of material, and they are not able to replicate their score of FMGs here, because more they read, more is confusion, because that is the problem that happens. So see if it makes sense to you. So what I'm saying, that make your notes your baseline with your preparation only with previous year questions. Refer to custom modules for tough and weak areas. As if you have paid, it doesn't necessarily mean that you have to use it. So let go the obsession of GTs, QBank, and many features that most of the platforms have to offer. So finally, a few words of wisdom. Lack of direction and not lack of time is the problem. We all have same 24 hours in a day with same material to choose from. Habits are reversible, but to reverse them we must realize them, that we have them, so we can stop practicing them. You have to be brave, you have to take risks. See, there are a lot of YouTubers who are giving a lot of strategies and everything, so you should listen to everyone maybe, but you should not spend a lot of time, and you should not try to implement what everybody is saying. So you have to take risk. Whatever I'm telling you, if it makes sense to you, you have to implement in your plans, and you have to create your own story of success. When flower tells the story of the season, only roots know the real story of survival. So what I mean, that I have released a lot of topper interviews, so their success you are seeing it is a flower, but their roots you will get to know when you talk to them. So I have talked with them and I have realized what is the real story of their success, and that is what actually I have tried to summarize in this video. You don't get what you wish for, you get what you work for. So don't just wish, and start working on your dream. Your lack of commitment and discipline is insult to those who believe in you. See, your parents believe in you, your friends believe in you, I believe in you that you are going to get a great rank and complete your dream. So show the commitment, show the discipline, don't get distracted. Stay away from social media, so away from the distraction for this period, and definitely you will get successful. So guys, I hope this video makes sense and give you insight for your planning, and I wish you all the best and